Hello, my name is Dr Afsana Safa. I'm a GP in Westminster in London. I'm also a clinical director for my primary care network, the West End of Marylebone. The project we have delivered is around remote monitoring for COVID-19 patients in the community. We really wanted to understand as primary care providers what we could do to help our patients in the community, which was a large number. How could we make sure that we were picking up people earlier, we were preventing deaths in the community, and that we were making sure that the right people at the right time were sent to hospital to save lives. And we were working with a really small committed team to create a way that we could remotely monitor patients in the community using oxygen saturation probes, apps or telephone calls, and we had a dashboard in our clinic. And the clinic is a kind of a hot hub that we called it, so it's a place where patients with COVID-19 can safely come and be examined and seen and looked after. So I think traditionally we like to think of healthcare being delivered by doctors or nurses or healthcare assistants, people who have been in the healthcare system for some time, who've been trained up in the healthcare system. We realised there was a number of people who were very talented, really bright, who unfortunately were without work due to COVID-19, and we were able to bring some of these people into our system to work with us. And it was really eye-opening to see how they took on the work that they were given. Firstly, the ease with which they picked up the kind of technological side of it, but also they had a real kind of customer service approach. I think in healthcare, although we're trained obviously to take the needs of our patients first, sometimes the system can be quite overwhelming, and occasionally patients can approach a kind of no first mentality in the healthcare system. But actually, with bringing these people in from outside of health, they came with a real yes first attitude. It was very much customer service based. The feedback was really overwhelming, both in how our team interacted with them, but also just this real sense of being cared for constantly throughout their illness. So the psychological element was something that we weren't expecting. We knew that we would hopefully have better outcomes in terms of lives saved and the right people going to hospital, but that real psychological element was not something that we were expecting to see, and it was great to know that that patients really responded to that. The two main challenges that we had, one was around the speed of deployment and the other was around how we rolled it out across a wider area. We realised we had to work very, very quickly, and we had a really small, completely committed, dedicated team that worked literally day and night for 3 weeks, which is a really short period of time to deliver something like this. And then our second challenge, like I say, was around the rollout across Northwest London. Overcoming that challenge was really around creating the story and telling the story, not just in terms of the financial and clinical outcomes and that value proposition, but also the emotional journey of COVID-19 and patients with it, and bringing all of that together. Finally, seeing the system work in a way that helped us to deliver, that helped us to provide such a fantastic service for our patients, just reignited that belief in the system that we can do this. Trusting in the creative process. I think often, again, you forget about creativity when you're delivering healthcare, and I think it's creativity that leads to innovation and that constant self-learning or group learning that we do. So it's been really enjoyable to discover creativity again, and understanding where our sources of energy come from and how we can be flexible to work in such a different way in such an unprecedented situation.